Respiratory acidosis and respiratory alkalosis. We're going to review these two first, and then we'll go over metabolic acidosis, metabolic alkalosis. Respiratory acidosis is always related to hypoventilation. If we're not giving them the proper oxygen, or there's a medical situation that is causing them not to get the proper oxygen, these patients are going to become hypoxic. So always related to hypoventilation when it comes to respiratory acidosis. Remember, respiratory acidosis, acid is obviously bad. The body does not like that, right? So the CO2 is going to be climbing up. The pH is going to be down. There's a piece of my hair that I just got in there. So CO2 up, pH down. There's a thumb trick that you can do with this when it comes to remembering these. So it's just going to be just like this, okay? When their CO2 is going to be climbing up, we refer that to as hypercapnia or hypercapnic patients. Systemic or cerebral vasodilation or both can occur. Once again, when hypoventilation occurs, hypoxia is going to be leading to that, right? They're going to have rapid, shallow respirations, a decrease of blood pressure, drowsiness, dizzy, disoriented, muscle weakness, headache, hyperkalemia, and dysrhythmias because of that increase of potassium. So dysrhythmias is going to be very common in patients with respiratory acidosis. Skin can obviously be pale to cyanotic. Why? Because of this. It's not having the proper oxygen to their brain. Again, this will help you remember the signs and symptoms of dizzy, disoriented. They're not getting the proper oxygen. What causes respiratory acidosis? You'll see that a lot of it is to do with respiratory depression, overdose, increased ICP, airway obstruction, pneumonia, COPD, ARDS. What's ARDS? Acute respiratory distress syndrome. Pulmonary embolus for PE, okay? So think of these patients with respiratory acidosis. They either have a medical emergency going on that they're not able to expand their chest wall to oxygenate for themselves properly, for them to have that CO2 just keep increasing. They can't blow it out, especially whenever it becomes to overdose. These patients that are obviously not breathing or getting very close to not breathing, respiratory depression, pneumonia, COPD, ARDS, and PE, these patients cannot expand their chest wall very well to get good oxygenation. So those patients are going to see that as well. Respiratory alkalosis, hyperventilation's occurring, too much release of CO2. So hyperventilation. What happens when we're hyperventilating? The CO2 is going to go down. So this one's going to be CO2 down, pH up. Opposite of respiratory acidosis. It can be due to seizures, they can have lethargic and confusion going on. These patients are going to have deep, rapid breathing. Hyperventilation, tachycardic, lightheadedness, nausea, vomiting, decreased or normal blood pressure, hypovolemia, numbness, tingling of extremities. The causes can be hyperventilation, anxiety attack, pulmonary embolus, fear, overdose on aspirin, mechanical ventilation. So if they don't have a medical situation that's causing them to become with their CO2 down, making them be having to where they're having too much a release of CO2, it can also be because of the mechanical ventilation that's occurring. So us as providers can be hyperventilating these patients. So when we see the CO2 being down, we need to make sure that we're not releasing too much of that CO2. They're going to have the lightheadedness and tingling of extremities. Why? Because if they're having this situation here of an anxiety attack, which we've all been there If you say you haven't been there, you're lying, but everyone's had a panic attack. You start becoming aware you're numb. Your hands, I can't even talk, your hands are going to become numb, tingly, start cramping. That's going to eventually lead to your lower extremities being the same thing. In those patients, they start freaking out even more because they don't understand what's happening. What is happening? Their blood vessels are constricting. Instead of having a nice blood vessel that's nice and open and that blood is just going through nice and smooth to where they're oxygenating appropriately and they're not becoming lightheadedness and numb everywhere, it's because of that constriction of those blood vessels. So once you have a patient that could possibly, obviously you can rule in, rule out if they're having a panic attack, have them reset their breathing. Close your eyes. Take a good breath through your nose. Blow it out. And just tell them to copy you for just a few breaths. And then they're going to start having that release of the cramping. The numbness is going to start resolving. Why? Because those blood vessels, instead of them being constricted, they're going to be nice and open and start having that proper oxygenation throughout their body. Seizures, obviously, they can't help that. So it can also be because of a medical situation that they're having. So once again, respiratory acidosis, respiratory alkalosis. These are the very two important things to remember here. Hypoventilating, hyperventilation is occurring here.